What's one myth about women's health you wish every doctor and every woman would unlearn?
Being a woman means suffering in some way or another and being okay with that. The current healthcare system kicks in only when you are already in trouble.
I noticed that only 15% of those who watch the podcast are subscribed to the channel. If you subscribe, I promise to make each episode better than the last. Today's guest is Svetlana Grinchenko, co founder at Strawberry Health, a startup redefining women's health and hormonal care. She's also a mom, an immigrant founder, and a vocal advocate for smarter, more proactive women's health. Welcome, Svetlana.
Hi, Elena. Thank you for having me and thank you for a sweet introduction. I'm indeed a founder, an immigrant, a mom, a dog mom, and yeah, happy to be here.
Great. My first question about medical myths and outdated protocols. What's one myth about women's health you wish every doctor and every woman would unlearn?
That is a great question. I think one of my biggest pet peeves related to women's health is this understanding that being a woman means suffering in some way or another and being okay with that. We talk about like painful periods, headaches, migraines, brain fog, feeling exhausted, all of those symptoms that are very, very common, but they're not normal. And I hear all the time how doctors or even the society call it like it's just stress or it's just being part of being a woman or it's just being part of aging and you should be totally fine with that. But the reality is you don't have to. There is another way to live your life and suffering shouldn't be any part of it.
That sounds great. And why do you think hormone testing and fertility support are still seen as a reactive care in the United States instead of preventive?
It's a great question. And in simple terms, the current healthcare system kicks in only when you are already in trouble. So, what does
Mhm.
it mean? They really want you to come up with something dramatic, like dramatic symptoms, or, for example, suffering from infertility and trying for a year before doing like any testing. So if you come to a doctor and say, hey, I want to understand my hormonal health because I am noticing I have less energy or I am working out in the gym and I feel like I'm not growing muscle as fast as I want, they
Mhm.
will be like, but do you want a hormonal panel? But why?
Mhm.
So this is kind of like how the system works. And I think it's totally broken because you do check oil in your car. You don't wait for your car to fall apart in the middle of the highway.
Mhm.
But this is what healthcare system actually want you to do. Once you have your car falling apart, they will come to the rescue. But if you want to be proactive, they have zero answers for you so far.
How do outdated medical protocols still shape the way fertility and hormone issues are diagnosed and treated?
Yeah, so another great questions. The most of the current protocols in women's health and related to fertility were developed decades ago.
Mhm.
And our life was slightly different. We were having kids while being younger, and most of the fertility care was centered around care, like treating infertility. So
Mhm.
this is where all of those advices, like trying for a year to conceive and coming back if you're failing, are coming from. And we do see that a lot of our doctors, a lot of our, experts are trying to keep up with the trends that proactive care should be the norm, that fixing things before they are completely broken is the new reality of healthcare. But there's a lot of pushback too, and there's a lot of this kind of like a legacy protocols where, fixed and I mean, things are not getting fixed. That's how it is now.
So, as I understand, you have seen resistance from clinicians and regulators to the kind of proactive model that Strawberry Health is building.
I wouldn't call it resistance, but we have seen a good share of it, and I totally understand why. Because if you have a protocol that you need to work in accordance with, of course, everything you want to do on top of that is kind of like a not regulated. It's not something your, like a medical board above you is approving. And I totally understand those doctors. It's not they do not want to treat you the way you want to be treated. It's more about how the things are currently, what is the norm, and what are the protocols widely adopted by all healthcare system and providers. But we do see a lot of interest from the providers and that are more willing to keep up with the newest trends. And that is mostly about like self-educating themselves. And we also see a lot of providers who are solely focused on the needs of the women, like Strawberry Health, for example, for hormonal testing, like Midi Health for navigating perimenopause, menopause, and taking hormone replacement therapy to the general public.
Mhm.
So the change is there and it's happening and it's great.
If you apply for 100 vacancies and hear nothing back, I can help you fix your resume so it gets past ADS and improve your LinkedIn so recruiters come to you. Book your session with me at Key People today.
And I also wanted to add about your previous question, like why all of that is happening. And a lot of that has to do with how the medical system is working generally. And you know that insurance is a huge topic in the United States, and insurance companies generally do not cover much when it comes to prevention. So this is another roadblock. Uh, but again, more and more things are getting adopted in terms of proactive care, and we are definitely moving in the right direction here.
Okay, thank you. And I want to share like my own experience that my OB-GYN in the US once told me that hyperdiagnosis doesn't reduce disease. It just creates more anxiety and opportunities for extortion. And honestly, I found that since moving to the US, I've become less anxious about my health. What do you think about this tension between proactive care and over medicalization? Where is the balance?
Yeah, well, thank you for sharing your story. That makes total sense, and I completely understand you. I think it's a fine line. Like coming from the Eastern European background where all kinds of testing were available, I could definitely see how hyperdiagnosis could be an issue. But here you need to struggle to get any diagnosis or like any testing. So probably here in the United States, I wouldn't say that it could be a big problem because all of the diagnostics that you do outside of your regular kind of like a physician OBGYN care is mostly out of pocket. And probably
Mhm.
that's one of the limitations why people do not get like hyperdiagnosed. But another thing is how do you view it? Like, do you really want to test something obsessively, or do you want to have some, like to test some important biomarker once
Mhm.
a year and leave with the peace of mind? And this is where I think it's where like my company stands, Strawberry Health. We recommend testing hormones 6 to 12 months depending on your goals. Like if you are looking to conceive in the next year or two, it probably makes sense to test
Mhm.
every 6 months to see where your hormone trends are going, if everything is in check. And
Mhm.
if you just want to do it for the peace of your mind, you can do it just once a year. But it's more about agency to me and not like obsessively looking at the numbers. For example, there's a very important biomarker that is almost never get tested here in the US, which is ovarian reserve. And what's it all about? A ovarian reserve shows you a woman how many eggs she has left at a certain point of her life. And as we know, women are born with the final amount of eggs they're going to have
Mhm.
till the rest of their life. And
Mhm.
knowing that, like knowing my number of eggs, gives me a great idea about like how do I align my current life and my current priorities with my future life goals. If I have this number and I know where it's going, how fast my ovarian reserve is declining, I can make much more, informed decision on like what are my priorities? Do I prioritize my health and wellness or my family planning or my career for the next like 12 to 24 months? So it's more about that balance and
Mhm.
um, giving women data that will encourage their agency and sense of control versus sense of like obsession and stress and anxiety about like monitoring each and every biomarker in your body.
Thank you for this like detailed answer. And I wonder which age do you consider as a like good age to test this hormone, like this ovarian reserve um, hormone. I forgot. AMH. Yes, AMH.
AMH, yeah,
Yeah. Yeah.
anti-Mullerian hormone. So in general, I would recommend any woman over 20 to do her at least one test to understand her baseline,
Mm-hmm.
and then probably do the testing every 1, 2 years up until she's 30 or up until she's like getting ready to expand her family and have a child.
Mm-hmm.
And that's another one of my biggest pet peeves is like we never test our hormones while we are feeling great. And that's a huge mistake because I really want to understand how my feeling great and full of energy and life and happiness looks like on paper. So
Mm-hmm.
that when things go, when life happens and something goes wrong or like my hormone levels start to decline, I understand where my baseline was. So if I want to replenish something or work on restoring my hormone level naturally, I want to understand what was that feeling great number
Mm-hmm.
instead of just like getting a very random scale of like, that's your probably green or red or yellow or orange number.
Yeah, to be honest, I agree with this with this idea because when I did my tests with your test kit, uh, I realized that norms are so wide. And for example, if I would feel worse and if I would feel like abnormal, uh, when I will make this test, probably doctors would. Like they would look at some normal norms, and these normal norms, they're really wide. Yeah, and I need to understand what is my norm. Yeah, because when we're talking about hormones, they can vary significantly. Yeah, and that's a great idea to take a sample of like a portrait of your doing great
Totally.
portrait. Yeah,
Yeah, I
a
call it
good.
hormone passport, and I really
Yeah.
want all the women to have the hormone passports ready and updated every couple of years at least. And when you're probably past 30, maybe every year, because this is
Mhm.
where more significant shifts are starting to happen.
Oh, stop. Stop talking about it. Okay,
But
so
it's great. It's just part of our life. It's not necessarily something bad.
um probably yes. It depends on your mood, probably in that in that particular age. Also, my own experience. When I was in my 20s, the message to millennial women was build your career, travel, enjoy life. And you can think about kids later. And now it feels like the message is like, oops, your clock's ticking, better freeze your eggs or you'll be infertile. You're heading into perimenopause, time to panic and get on hormone replacement therapy. It's all fear based, and the solutions are very expensive. What do you think about this shift? Is it really about care, or is it just another form of pressure on women?
It's a great question. Well, first of all, I absolutely hate everything that has that kind of like a panic focused marketing, or like that offers that fear-based care or solutions. Not that I hate, but I feel like we can easily commercialize the fear and panic, but do we really want our women around us to make their decisions out of fear and panic? Or do we really want them to encourage, inform, and educate so that they can make their decisions out of abundance of knowledge and understanding their own bodies, having their own personal data that is as unique as they are? And me and my company are totally 100% focused on this second approach, but I absolutely understand that first approach as well. And speaking about that kind of like a societal shift where it was totally fine to like build career, live your life in your 20s, and then suddenly at 35, you were like, oh my God, you need to freeze your eggs. Well, first of
Yeah.
all, that doesn't contradict each other. Like you do need probably to freeze your eggs in your 30s because you never were thinking about your fertility health in your 20s. Or that's kind of like a very contradictory topic to me. Like
Hmm.
my take on that is get as much information as you can in your 20s so that you can make informed decision that I'm gonna have fun for the next 5, 7 years. But what does it mean in reality? You probably need your full hormone panel to understand that when you want to have kids, you will be able to have them without taking any measures right now. And another thing is, which is very, very common here in the US, is like being on hormonal birth control since very young age. And what does it mean? If you're on hormonal birth control, you do not ovulate, and ovulation is necessary for having a baby. So if the woman is on a hormonal birth control, say like from her early 20s up to like mid 30s, for those 15 years, she doesn't understand if she ovulates at all. So
Mm.
she has this kind of like a mm, delusion that whenever she wants to have a kid, she would just be able to have it on the first or second or third cycle as soon as she gets her birth control. But reality is, if you discover that something is wrong with your menstrual cycle, with your ovulation pattern, with your hormonal panel at 35, you might spend another like 3, 5 years fixing it. And if you are trying to have a child when you're 40 is very different when you're trying to have a child in like in your 30s or when you're 35.
Mm.
When you're 40, you might need like assistance, like IVF cycles. So my take on that is like you do need to do your testing, do your homework, understand where you stand, and then go have fun, go build your career. Maybe you do need to freeze your eggs in your 20s so you can have a fulfilling, life for the next 10 years. But freezing your eggs in your 20s is totally an option, and that's an okay option. It's not something to be ashamed of or scared of. If you're not willing to build a family in the next 10 years, it's totally fine, but you will have much higher chances of conceiving a healthy baby if you think about that, like earlier in your life.
Need tech talent fast? At Key People, we connect companies in the US and Europe with elite tech experts from Latin America and the EU, top tier skills and optimal costs. 91% success rate. Women own HR smart, tech savvy Click the info box to learn how we can hire your next tech star. And I was thinking, since you said like, oh, you're in your 20s and you want to have fun, you want to have fun before kids. So is there any fun after kids, Sveta? Because
Totally. There's tons of fun after kids. Actually,
because
kids make your life much more fun. And also they make appreciate your kind of like a solo fun much more.
uh, yeah, got it. Because it's like totally another topic, but I was thinking that maybe it's not a very great conception of having fun and then having family, like having career and then having a family, because maybe we should mix it. Maybe we should like change places. Maybe we should reschedule something if it's going that complicated after 30, for example. Yeah. So it seems like, but it's,
Nothing is really complicated. I don't think it's complicated. It's more about we are supposed to kind of like a pop out beautiful plump babies whenever we want to. And we as women have this kind of like a hold this shame and guilt if it doesn't, I mean, if you don't succeed right away. And
Mhm.
this is something I really want all the women to think about. Like everybody is different. There are much more, like there are many, many more fertility issues among women like you and me. And there are tons of the issues we are not even aware of, but which probably were more like abnormal like 10 years ago, but much more normal now.
So, what advice would you give founders trying to build in women's health without falling into the pink washing trap or fear-based marketing?
Do not build with the fear-based marketing. I mean, I understand it might be profitable, but I think women are smart. And if your users, your customers, your patients are women, you can only go as far with that fear-based marketing. But you can go way, way further if you build trust, if you build community, if you show them that you do solve their problem. So my only advice is just not to fall in that trap for the low-hanging fruit and fast results, but something that will ruin your trust and your long-term vision for building a sustainable, profitable business.
Thank you. And maybe the next question will be a bit provocative, but I wonder, like, you're building a product in a space that's deeply personal and scientifically complex, but you don't come from a medical or academical science background. How do you build something credible and trustworthy in women's health without a traditional medical education? What helped you bridge that gap?
Well, thank you for this question. I get asked about that a lot. And honestly, I never pretend I'm coming from a medical or scientific background, but I get asked about that all the time. Like, are you a doctor? Or like, are you a researcher? Are you an inventor? But the reality is, I come from a business background. All of my background is in business and operations. And I think as a person with business background, I know exactly how to build that bridge between what people want and what medical system and newest research are able to provide. So I take pride in coming from a business background, and I find the best doctors, experts to walk with me on this road. My
Mhm.
co-founder has built in women's health before,
Mhm.
so I'm not building this business on my own. She has built a fantastic sustainable period care company, and her products were sold in 73 stores across the US. And while doing that, she has interacted with thousands of women. And I joined her at some point. So it's not that we are not coming from the background where we know like what women want. It's quite opposite. And also we have a strong medical team, and we are also leading a community of builders, operators, experts, and scientists and doctors who build in women's health here in the Bay Area. We started that because we couldn't find any. And now we really want so many people. If we don't have any expertise, we just know where to ask and we always get the answer.
Well, so that's great. So you're like a customer advocate in this field more than medicine advocate, but like that's interesting and kind of inspiring because I think there are a lot of entrepreneurs that are looking into this highly scientific or medical fields, but they're afraid of moving there because it seems like you won't be trusted until you're um, a doctor or a scientist or something like that.
And you need to find other ways to build trust, like start building community and show up and be consistent and get shit done and let people know about that. And also just don't, like use any fake, kind of like a don't use any fake statements or um, just use only verified data backed by your like medical board or scientific board. And this is what we are doing.
So we're already here in the topic of business, and you and your co-founder, also Sveta, you're a female founder and an immigrant. What surprised you most about starting a company in Silicon Valley?
Well, first of all, what surprised me is that I can actually build a company because coming from Russia and coming from a background where I was thinking that big businesses or like big money was only, available as a career if you are dealing with police or mafia or you, you need to have all those connections. Like
Hmm.
coming in the Silicon Valley and understanding, realizing that you can just build a business
Hmm.
is was the kind of like the biggest revelation for me. And not only discovering that, but also like seeing people build businesses. In Silicon Valley, I think there are so many career shifters and people from all kind of backgrounds are building businesses. So that is extremely inspirational for me. And yeah, I love it. I love living here. I think it's a magical place.
Definitely, and high energy, high.
Totally.
But was there anything that turned out to be easier than you expected when launching here?
Yeah, totally. I think the how approachable people are and how generous they are with their time. Again, I think Silicon Valley is a magical place in a sense that people are totally fine to give back, provide advice, share their experience with you, and oftentimes completely for free. And everything that you need to do is just reach out, be genuine. Um, Offer something, and they will respond. So to me, it's still some kind of magic that happens almost every week. But this is the reality.
So let's take a look at the darker side. What were some of the hardest moments, things no one warned you about?
That's a great question. It's not that no one warned me, but I think fundraising as a woman, as an immigrant, as someone building in women's health has been hard in terms of the most VCs are we're not getting, or like I remember like a year ago we were getting questions like how big is the market if you
Hmm.
build in women's health. So we see a lot of like we see a big shift now.
Hmm.
A lot of investors are much more interested in this space thanks to the a couple of really big deals and a few really fast growing companies in this sector. They still, I would say, lack, expertise and they still look around to see like
Hmm.
what the others people in their network would be doing. But yeah, I think fundraising, and especially from the traditional VCs who were like investing in the B2B SaaS, and suddenly you're pitching them about like women's health, that was quite challenging.
Mm, yeah, so uh, in terms of easy money, there is no there easy money in Valley right now, as I understand.
I don't think easy money is ever available. I mean, probably for those who kind of like
In
it's from
2020, in 2021, I believe we had them
yeah, but
here.
honestly, I wouldn't call any money easy. Behind all the like every company and behind every easy money deal, there are, thousands of hard work. So
Yeah. And okay, so did your status as a woman or and immigrant ever visibly change how investors or partners treated you?
not really. I don't think I have ever, experienced that kind of like a sexism that is oftentimes described in like the bro culture. But I must say, I was pretty intentional with the communities I belong to and the support circle I build around myself. And this is true both for like advisors, investors, experts. So I probably was in the right rooms,
Mm.
and I was trying to avoid the wrong rooms as much as I can. But yeah, that's my reality, and there is no way to, escape it. I am a woman, I am an immigrant, I am speaking with an accent, I am a mom with a family. So my priorities is very different from a 20-year-old dropout building out of a garage. But this is my reality, and I'm dealing with this, and I'm building regardless. And I encourage, every person who is considering that any of those, aspects to be a roadblock, don't. You are not, like, you are who you are, and just go and build it.
Oh, thank you. Really that's really inspiring too, because when I was talking to one VC from Los Angeles, and she invests only in women-owned companies and usually targeting like women's health and other women's related stuff. She shared the data that around 90% of money are still going into men's hands. And this is the reality right now. So it's getting better. It seems like it's getting better. But it's not that liberal and fair as it could be seen. Yeah, so it's still like a battlefield, let's say so. And do you think the Valley is getting better at backing female health startups, or it's still a boys' club with a new pitch deck?
Well, yes, and yes. I see more interest in women's health startups from everyone, including VCs. But yes, it is still pretty much a boys' club. And as I mentioned in my previous answer, you should be okay with that. Unless you want to turn a boy, that's where you are.
Mhm.
And there was an interesting report shared recently by Graham and Walker, a great VC firm who are pioneering like female founders. And in that report, they shared that according to the latest numbers, the funding that go to like female-only teams has gone down from 2.6% to only 2% in the last like 7, 8 years. That means that although we see a lot of kind of like a talk, or we see more faces on stages, like from female founders, and we see more conversations about supporting female founders, in reality, it is not like that. And again, I think it's
Wow, that's upsetting.
it is
Yeah.
upsetting, but what can you like, how do you frame it? Do you really want to kind of like sit there and cry
Yeah,
about
no, yeah,
that?
yeah. I mean,
Or
I just want to understand the reality. Yeah, and
yeah, yeah,
it seems that reality is a bit different from those social trends that we think exist somewhere.
yeah.
How can women founders protect themselves emotionally and strategically in biased fundraising environments?
That's a great question. And I think it has to do with the fact that um, women are, I think women are very resilient. So we have that grit, we have the courage to build, regardless of all the roadblocks. And for most women, I would say you just need plan B and plan C. If you cannot get investor money, it's totally fine. Think about how you can build your product and become a profitable business without VC money. Because when you do, like when you are ready to take VC money, you're also giving up a little bit of control and um, interacting with VCs from the place of that is one of my options versus you are my only option to survive. It's very different. And I think for women, it would be extremely helpful to think twice if they really want to do the VC route
Mm-hmm.
or they want to think about other options from the very beginning.
Yeah, just see other options like pretty smart. And what would you say to the next wave of immigrant women with big startup ideas but no connections?
I would say go build it. Don't obsess about building something perfect or don't obsess about, building the right connections right away. Just go build it, give give it to 10 people you know, ask for their feedback, iterate on your prototype, and start building those connections. Like gradually be more vocal and visible on LinkedIn. Reach out to people. People are very open here. So if you're genuinely asking for help and being open about your struggles, people are willing to help. And I just want to share one thing I was thinking about lately. Like as a founder or as a, business owner, operator, you will hear 99 reasons why you shouldn't be building what you're building. So
Mm.
just disregard those. Just don't take them. Don't internalize them. Take that 1% that is encouraging, inspiring, or giving you very practical advice and build on it. Just forget the rest 99%. Because we as women are so vulnerable in terms of we have been taught to be like perfectionists or be better than anyone else in the room to even like keep up with the boys. Um, and we are living in this culture. I mean, we were raised in this culture, so just forget it and go do something and only take feedback, advice, help, and encouragement. Don't internalize anything else.
Yay. You know,
Cheers!
I mean, yeah, yes, like cheers. And thank you, Sveta. This is really inspiring. Like, I only have the very last question, and it's gonna be like one belief about women's health you hope is obsolete in 10 years.
That we are lose our fertility at 35, and at 45 we are kind of like a menopausal women who are probably should be getting ready for just dying in the next 20, 30 years.
Oh my God.
I think I think okay, we'll need to redo this. The whole thing. My answer is very my response is very depressing.
But it sounds so true. Why not?
Okay, so I think what's going to be absolute in 10 years is that women are small men, like just smaller versions, shrunken versions of men for the healthcare, and also that every woman should kind of like follow that um, timeline where you are super fertile in your 20s, then your fertility starts to decline after 30. 35 is probably your last chance to have a natural pregnancy, and 45, you should be getting ready for menopause. And that is like a mysterious state when you lose your feminine part in one way or another, and then, like you don't understand what's happening for the rest of your life. So I really want every woman to understand that her fertility timeline is absolutely unique, that
Mm-hmm.
her health journey is absolutely unique. And nowadays she has all the tools to live her best life at any stage, at any age, and that no scale will define how happy, you know, um, vital, energized I'm gonna be in my 30s, 40s, 50s, 70s, 90s. I don't know,
Yeah.
exercise, eat healthy, laugh, spend time with your loved ones, go hug your dog, uh, walk outside, test your hormones, and just do all this consistent health testing that builds this foundation for your health decisions further on the road. And yeah, just live your life every day, all days of your life.
Yeah. Thank you so much. Thank you for this inspiration and for all the kind words. Thank you for being here and bye.
Thank you, Elena. That was a great conversation. Bye.
Yay. See ya.